During spinal fusion surgery, bones are meant to heal together. If the area moves too much, that healing can't happen. Spine fusion hardware is used when motion prevents proper bone healing. This hardware usually includes screws connected by rods or plates. Instability means abnormal motion between spinal bones. Excess movement can irritate nerves and stress healing tissue. Hardware limits motion while the body grows new bone. Screws anchor into strong bone to control movement. Rods link anchors, forming one stable spinal unit. Together, they limit bending, twisting, and side motion. Reduced motion protects nerves and healing bone. The number of fused levels affects hardware needs. Single-level fusion may need less hardware support. Multi-level fusion spreads forces across more anchors. Weaker bone reduces how firmly screws can hold. Stronger constructs help prevent loosening in weak bone. Hardware also helps restore and hold spinal alignment. Areas where the spine transitions experience higher stress. Neck to chest and low back to pelvis regions often need extra support. Sometimes front or side support shares mechanical load. The approach varies by anatomy and surgeon preference. Bone healing continues for months after surgery. Follow-up imaging helps confirm stability and fusion progress. Hardware improves stability, but the fused level no longer moves normally. Comfort depends on healing, alignment, and overall spine health.